Hi, so my name is Vicky Swann and I'm Programme Manager for Mental Health at the MRC. I'm going to talk to you today about the upcoming call for funding for a mental health data research hub. This is launching on Monday, so very soon, and I will be going over the background of the call and some highlights of the call specification, assessment and process. But as it is out on Monday, you don't need to make too many notes. Hopefully any questions will be answered on Monday and addressed in the fuller document that you'll be able to see. I'm also going to go over a few of the outputs from the brief survey that we conducted prior to launching the call and that many of you, I'm sure answered for us. Thank you very much for that. So, mental health research at the MRC is a core strategic priority. It is one of our health focus themes in the Strategic Delivery Plan 2019. We are, at the MRC, we are one of the leading funders of mental health research in the UK, spending almost £48 million in 2018 alone. The MRC Strategy for Lifelong Mental Health Research launched in 2017 and outlined priority areas of focus to complement our standard funding for mental health through our normal grants and fellowship streams. The part of this was identified a development of a coordinated and integrated informatics resource for mental health research, which was identified as a key priority within the strategy. The reason for this featuring as a priority in the strategy is the breadth and scale of opportunity for impact from making better use of mental health data. By unlocking the power of data, we have the potential to inform our understanding of the etiology of mental health problems, to accelerate the development of new treatment approaches and to improve care, to identify new targets and biomarkers to improve diagnosis, prognosis, treatment, prediction of response, to give us a better understanding of comorbidities and the complex interactions between physical and mental health, and it will allow us to inform strategies for early intervention and for prevention. There's a huge range of opportunities, and to capitalise on these, we need to look across a wide range of factors that play a role in our mental health, such as biological, clinical, social, and environmental data. There are a range of factors at play, and we need rich data resources to better understand how they interact to affect mental health at an individual and population level. As funders, we have already made substantial investment into the generation of some of these data sources, including cohorts and longitudinal studies. And we are committed to maximising the research opportunities that such a diversity, richness, and quantity of data provides. So in 2018, the MRC funded 9 leading universities from across the UK to address key challenges or demonstrate exemplar studies that would help researchers to harness the power of data for mental health research and inform the establishment of an integrated data resource. Funding for these Data Pathfinder Awards, as listed here, totaled £10 million and addressed areas including data discoverability, interoperability, access and sharing, methodologies for data linkage of diverse datasets, harmonisation of measures and outcomes in longitudinal and clinical studies, incorporating a broader range of physical and mental health outcome measures in population research and clinical studies, and enhancement of existing cohort and longitudinal studies. The Data Pathfinder initiatives are now coming to completion, and we are launching this call for the hub in full expectation that it will build on the learnings from the Pathfinders and capitalise on outputs that have emerged, and that we want to see that in the applications. So the call specification, so to confirm, this is for, we're looking to spend £2 million for 3 years of funding for one hub. This call is being launched to establish a hub in partnership with HDR UK. This means that the hub becomes part of the broader HDR UK network and aligns with the principles of participation set out by HDR UK, and participates in the Health Data Alliance and improves data discoverability through the Health Data Innovation Gateway. The benefits of doing it in this way are that the Mental Health Hub has access to a range of relevant expertise, participation in broader policy level activities, and opportunities to work across other hubs in the HDR UK network as well. As I said before, we do expect the proposals to build on the Pathfinder initiative. Many of the groups are here today, I'm sure, and have presented at previous meetings about their project. The call is open in eligibility, it's not exclusive to those groups, but we do expect to see the relevant findings from these projects to be built on in proposals, given that the Pathfinders were launched to begin this exploration into approaches for a national mental health data resource. A related point here is that we want to see applications positioned clearly within the landscape, or how they will link to and complement or collaborate with existing activities to add broader value. That is adding value to the landscape, addressing a clear unmet need that requires funding for this data infrastructure and service model. We're not looking for duplication, we're looking for impacts that couldn't be achieved through existing investments or funding models. In terms of the expectations that we're looking for this hub, it would be expected to improve discoverability, quality, breadth, depth, and utilization of data sets. We'd want it to act as a centre of excellence for curation of mental health data at scale. We'd want it to provide UK-wide expert data research services and also to help users navigate the landscape. We'd want it to identify and address unmet user needs and be driven by strong exemplar cases. These users could include the needs of academics, NHS, industry, charities, and I'm sure others. The hub outputs are not for the sole benefit of the hub team. They need to be very clearly be driven by the needs of a range of users from across the UK. And there is also a need to be outward facing and not be the source of competition, but help to build more competitive research. Related to this, we need to see some clear exemplar cases that demonstrate the potential for real world insights, innovations, and improvements that are not currently possible or not as easy without this investment that we're making. We also want to see public and patient involvement and engagement throughout in development, decision-making, and governance of the hub. And we expect the hub to be designed with capacity to evolve, to respond to changing needs and opportunities, to bring in additional funding and grow in ambition. We would want to see plans incorporated for sustainability of the investment, including through grants, industry investment, and didn't know I could do that. And we want long-term sustainability. Sorry, I lost my notes there. So some of the key strategic areas we want to see the hub in the hub is we want to see it being driven in terms of the data sets included and the approach to curation services. This reflects the MRC mental health strategy as well as the feedback from the consultation and other inputs. We want the hub to be offering a resource that facilitates a precision approach to mental health. That allows us to be more targeted and informs our understanding of what is most effective to prevent, treat, and manage mental health problems at an individual, a community, or a population level. Within this, we expect the hub to include a breadth of data sources, including biological, clinical, and social data. Recognizing this breadth of detail is really needed to delineate these issues. We also want to see a degree of focus in the hub data sets selected and the hub strategy to addressing the importance of, firstly, capturing data across the life course, including children and young people. For addressing, secondly, the interdependencies and interrelations of physical and mental health. And also certain population groups most in need of support or those who are traditionally underrepresented in studies. An important point to make here is that the funding is designed to support data as infrastructure. While we expect the hub to underpin research funded through other routes and improve its competitiveness, it is not being funded to conduct that original research itself. So this is the timeline for this call. As you can see, it's quite tight. So we had a survey that many of you will have contributed to in November over the last few weeks. And the call will go live on Monday, on the 7th of December. There is an intention to submit deadline at the end of January and the deadline for full applications at the end of February. International panel review and applicant interviews will take place in March. and decisions will be communicated in early April. So there is no postal peer review for this. It will go straight to a multidisciplinary panel with both international and PPI representation. In terms of the applicant teams that we are looking for, we are requiring that bids include applicants from across at least 2 institutions. This is to reflect the value of regional data sets and leadership, and so those collaborations will be more meaningful where they come from distinct regions within the UK. We are also strongly encouraging cross-sector partnerships with industry, NHS and charities, for example. Bids that demonstrate those links and have clearly value-adding partnerships across a range of users and stakeholders will be in a strong position. We have limited the number of applications from a single institution. We can only fund 1 hub, so there's an operational argument to manage demand. But also we want to emphasise that we want the essential collaborations to have been established at the application stage, bringing best with best to develop the strongest possible bid for a hub that can be truly deliver this as a service to benefit the mental health research field broadly. Lastly, the intention to submit stage is mandatory because we need to know about conflicts with the panel. We have a very tight time frame. It will not be assessed. It is purely for our own information. So I'm now going to talk about some of the consultation survey outputs. This fed into our development of the call, as well as other inputs came from the Pathfinder projects and the meetings we've held across this grouping and with other stakeholders. Some of the outputs generated from the MQ Data Science group and a brief consultation held at the MQ Data Science meeting this time last year also fed into it. The MRC Mental Health Strategy and the Digital Innovation Hub programme that has funded a number of data research hubs in HDI UK network has also fed into this. So this survey can tell us about what academics value and prioritise, but the applicants to the call will need to demonstrate how wide a range of stakeholders have been consulted. So it's a useful snapshot, particularly given the direct feedback requested on the hub specification, but it's certainly not exhaustive of user needs and should not be used in isolation to provide that evidence. I'm going to give you some brief outputs from what we found, and a longer report will be published alongside the call specification. So survey respondents were asked what data sources they use, and clearly a diverse range of data sources and data types are used by mental health researchers, with population and patient cohorts, health records and administrative data accounting for 50% of the data sources. This worked out at around 4 to 5 different data sources being ticked on average per respondent. We also asked about strategic priorities. We asked respondents to identify the priority areas against which the hub should focus on over the next 3 years. And in general, there was general support that all could be usefully and impactfully addressed by the hub. But the main support was for a precision approach looking across mind, body and brain, early intervention and prevention, new and improved interventions, and a life course approach. This has all been integrated into the call. There was also, we found that useful input came from the justifications from those responding as to why they'd selected these areas. This will be captured in the survey report as well. The main emphasis is on using the data to generate the evidence base that allows us to be much more targeted going forward in prevention, treatment and management of mental health problems. This hub is we're funding 3 years, £2 million, which is quite a broad and will give you quite a broad scope. But we will be starting in a strong position off the back of the Pathfinders and other data science activity. It might be that some of these aspects mentioned here are not there at the outset and are brought in a bit later, but we would like to see a clear plan for how these priorities would be tackled in your applications. So another question was about data attributes. So in relation to the previous question, we asked respondents to reflect on what they said and to highlight the important attributes for the data sets to be included that would allow them to address those challenges. There was some degree of overlap in the attributes, but unsurprisingly, the main critical factors were data that can capture longitudinal trajectories, data that captured a breadth of detail about a person, and data that can better reflect the diversity of the population of interest. Again, the narrative around this was quite useful and will be pulled together in the survey summary that will be published in the next week. So the hub will make data discoverable via the HDR UK gateway and will also curate data and provide services to improve its use for research. In a survey, we asked what services the hub should make available to users. So I've listed them here, and this reflects the average ranking order by respondents, but there was quite a lot of variability. So one thing that was the highest priority for one person might have been the lowest for another. I think part of this came from possibly how familiar and capable somebody that was responding already is with mental health data and with the science landscape, and how they would go about using data in their own research. I think the levels of need probably ranged across the users. So within the hub specification, we have made it clear that facilitating data linkages, as at the top, will be valuable, as well as improving interoperability across key data sets, helping users navigate the data landscape and enabling research that uses data sets across regions. We also asked in the survey what success would look like and what factors would be critical to achieving that. So one of the main factors that would be critical to success would be collaboration and inclusion. So across sites, across the UK, having a very clear focus on benefit to the wider field rather than a few niche research areas, and really building on the excellent pockets of work that were already achieved. It was also clear that success would require engagement from data custodians. So we'd want to see how the hub will collaborate with and achieve buy-in from the data holders. Also effective engagement with key stakeholders. The hub needs to be a two-way interface, ensuring the hub is driven by real unmet needs. It was clear that users would want ease of access. They'd want it to be transparent, streamlined, accessible without having to have extensive training, and have clean and complete data. They'd also wanted to see streamlined approaches to data linkage, overcoming the regulatory hurdles around this. And in addition, an inclusion of a range of data sources. So a balance of biological and social approaches, common and severe mental disorders and life course stages, capturing regional and individual level variables, mental health and physical health. There was also some suggestion that skills would be critical to success. This aligns with broader HDR UK activities in skills and capacity. And it is clear that data science capacity and nurturing talent in this space will be critical for the hub. And of course, patient and public involvement. Public buy-in is critical, and we need involvement at all levels to achieve that. So thank you very much for listening. We'll have some discussion now, but if you have any further queries once you have read the call document on Monday, please email us at mentalhealth@mrc.ukri.org to discuss it in more detail. Thank you.